Fistula is an abnormal communications between the urinary bladder and the vagina due to prolonged labor in women without relief. The situation brings about the discharge of urine or feces or both in some cases, with the woman not knowing. For these experts, Professor Dosu Ojengbede and Dr. Ayodele Olagunju blamed cultural belief that always blame spiritual attack when such occur, rather than seeking medical solution, which had left many women in agony and pains.
Well, this is something that can be totally, absolutely preventable if the system prepares itself to prevent it.
This is highly distressing because you now see this kind of women having withdrawal to self. They get withdrawn. You see them being abandoned by their relatives.
This 62-year-old woman had suffered fistula for 29 years until this moment, while this 31-year-old woman suffered prolonged labor that led to fistula injury because she was believed to be COVID-19 positive without proper tests carried out. The case of this 16-year-old young mother was not different.
I gave birth on Monday. I noticed on Friday that I was passing feces from my vagina. From vagina and from my anus at the same time. I was like, this is unusual. They did test, that the test came out positive, that they had to change me from that labor room to another room. I was about to climb a staircase. I noticed that the baby was on my laps already. I had to hold the baby with my leg. I was like, doctor, this baby is on my laps. The doctor and my husband, they had to carry me. Immediately they dropped me on the bed. The baby pushed out on her own. That was how I got the tear.
Going to 29 years. Ìgbà tí mo bímọ náà ni prolonged labour ni ó fà fún ọjọ́ mẹ́ta.
Bí mo ṣe labor fún ọjọ́ mẹ́rin ló fà.
Professor Ojengbede and Dr. Olagunju shed light on fistula and its management.
Injury caused either by the baby passing through the birth canal of the mother during childbirth, when the birth canal is small for the size of the baby. It could be that the baby is normal size, but the birth of the woman is small, or it could be that the birth canal of the woman is normal, but the baby is unduly big, or is not lying appropriately.
The hair of the urinary bladder and the vagina now sloughs off and they become continuous. Such women cannot hold urine, and the essence, you now begin to see them dribbling urine. They cannot control urine. They are not aware of when they are passing urine.
They also urge women to always book pregnancy early in a good antenatal home and urge non-experts in treatment of fistula to always refer patients on time to avoid further complications.
You can space your pregnancy and prepare well ahead for them such that you are able to seek good care. You are able to pay for it.
We have been repairing this abnormal communication, and what it involves is repairing, separating the wall of the bladder from the vagina, repairing the bladder wall separately, and repairing the vagina wall separately.
The expert said while fistula is becoming things of public importance, it is worthy to emphasize that prevention is cheaper than cure. Femi Amushon, AIT News, Ibadan.